When the caregiver is to perform wound care, a pure routine is used where the caregiver disinfects his hands and forearms. Then the caregiver puts on his neoprene gloves and then begins to clean the tablecloth table with a surface disinfectant that contains surfactants. After the table is set to clean, the caregiver can set up wound cleaning supplies. Then when it comes to debridement of the wound, highly clean material should be used where the caregiver can clean the wound with sodium chloride 0.9% 500 ml and 500 ml clean collection syringe and with debridement material such as wound cleaning surface debris soft lolly, Loman and Rauscher. Then the apron is put on and again the hands and forearms are disinfected and then the neoprene gloves are taken off again. The next step is to remove the old dressing and then disinfect hands again and put on new neoprene gloves, as the old ones become contaminated with bacteria, then cleaned with sodium chloride and wet compresses as well as around the wound edges with a unique compress for each area. The neoprene gloves should not touch the wound to avoid care-related infection. Next, neoprene gloves are removed and the hands and forearms are disinfected again with hand sanitizer. The last step for patient care is to apply a new hydrophobic dressing to the wound and apply a superficial dressing to the skin, where this step can be done without gloves, but then they must not touch the wound and be hand sprayed, hands and forearms. Hand disinfection is performed at the end of the application of the wound dressing. The last stage for the wound dressing is to get rid of residual products in the waste bag. All surfaces that have become contaminated during wound dressing and are for reusable use must be disinfected to prevent care-related infections and stop the chain of infection. Finally, spray your hands and forearms again after cleaning the roof surfaces. How you ethically treat the patient is by asking permission to perform wound dressings and telling why you should perform for so long and how wound dressing will go and the effects of performing wound dressing on a contaminated wound. It is important to think about the 4 ethical principles such as the principle of autonomy, the principle of goodness, the principle of justice and finally the principle of goodness. These principles exist so that the patient is not violated and receives good care in the hospital, in intensive care or regular inpatient care. It is also common for larger wounds on the lower extremities to be wound washed during surgery, which is common in an orthopedic emergency department. For difficult to heal skin wounds, a vacuum-assisted bandage can be applied to the difficult-to-heal wound that is connected to a vacuum machine that sucks fluid out of the wound through transparent tubing to the vacuum machine's container. First is measured, then the skin area around the wound is cleaned, then sterile dressing cut out and applied around the difficult area of the skin and then black polyurethane foam is used in the wound, which then gets additional barrier plastic over it where the operator cuts a circular shape from sterile plastic. Then the main parts of the hoses are placed on the difficult-to-heal wound, which is attached directly to the black polyurethane foam, which is then activated by the vacuum machine by the caregiver clicking on the activate button on the vacuum machine. 1. If the patient has been neglected in intensive care or surgery or in their closed emergency department, the patient can complain to the care clinic where the patient has been treated unfairly by, for example, staff. A higher instance would be a patient board in the Stockholm region, or an even higher instance, which would be EVO, Inspection for Health and Care. The patient has the right to receive an explanation from the closed care unit either in writing or orally or by telephone within 4 weeks. 2. The patient who appears to have been neglected in the course of care through the hospitals in which the patient has been treated must be treated with respect at the treatment, and the care provider must see from the patient's perspective. When a society suffers from a pandemic such as the COVID-19 virus, it is important for the caregiver to read information from the WHO, World Health Body Organization, 3 for all healthcare in the world. Other sources could be 1177. SE4, which is a site that tells clearly and simply about diseases. INTIRONEST.org. 5 is another site that shows news about the new methodology for anesthesiologists on nerve blockages. The important thing is that information that reads as a caregiver has information that comes from primary sources that are usually authorities in Sweden, such as the National Board of Health and Welfare. Avoid social media and television as sources to deepen your knowledge or educate yourself. There are very good YouTube videos that are about, for example, How to insert a peripheral venous catheter from American hospitals, where doctors show ways to intubate when the patient has COVID-19 infection and insert a peripheral venous catheter, but should be seen more as an inspiration. Then movies can provide an understanding of the subject but should not be primary sources. Other sources that are good for updating about viral diseases are via the Public Health Authorities page 6 and via workplace statistics, which are usually presented by the head of the care unit for the emergency department. Laws that can be applied. Types of laws that can be applied in nursing work are the 7 Patient Safety Act 8, the Health and Medical Care Act 9. The Patient Act advocates that the patient should be given information about their health, be given a time to know when care should be given to the patient, be given information about what aids are available for the patient, such as crutches or a walker for mobilization. The patient should be given alternatives when the caregiver is to perform nursing and, for example, should be given new pillows, bedding and socks. The Patient Safety Act stipulates that care personnel who provide care and attention to the patient must be based on their actions, that they do not harm the patient, and that any deviations that could have led to a care injury must be reported to the hospital's deviation system. The Health and Medical Services Act is about the treatment given to the patient must give the patient good health, and care given must be given to everyone on the same terms. Then the patient with the greatest injury should receive emergency care first, triage. Reflection and discussion. Reflection at work and during and after work is important for the professional role as a caregiver to learn about themselves and their profession and develop an understanding of the patient's journey through health and medical care. In the care work, it is important to think one step further about the reasons why the nursing work looks like it does in Sweden's health and medical care. Deepening their theoretical knowledge is good because it is possible to answer questions that patients usually have during the care process. Reflection does not only occur for the caregivers but also takes place in an intensive care unit, where the caregivers write down what has happened to the patient while the patient has been intubated and asleep. Daily the diary is usually filled in by intensive care staff so the patient can read and process cognitively about what has happened in retrospect during his stay in the hospital in his home. Reflection can give the soul peace and quiet by the caregiver coming to terms with his life and his professional practice.